S&G Labs has been in Hawaii since 2013. So we're not a new lab, but our focus has primarily been in the realm of toxicology. So with the COVID-19 hitting the islands and knowing that our resources are limited in how many labs we had there locally to test, I decided that instead of having to furlough people, let's redirect people's efforts, and we have an amazing team. So we have been working around the clock to bring everything we needed in to be able to do the PCR testing in-house in Kona. So our goal was really just to be here as an added support to the islands to serve. And we're really excited and we're ready to get rolling in about a week.
And I know a lot of people are looking forward to having more capacity for testing. We often hear about just kind of the inability to do local testing, the turnaround times. What is your take on all of this conversation that's happening? Do we have the capacity to do more local testing here?
Well, I think that everybody is trying, DLS, clinical labs, everybody is working hard for the same end result, right? To win this war on COVID. And we just felt like if we can be a part of that and help serve, we're one other location. So my hope would be that we can help with the overflow that they might have. Some of those samples at times have had to get shipped off to the mainland to sister labs to be able to get a quicker result. So if we can keep it here in Hawaii, obviously it makes more sense for everybody. It's pretty easy to follow and we can get a result quicker. So we're hoping to have, depending upon volume, 1 to 2 day turnaround time.
Yeah, that's amazing. That makes a huge difference in terms of preventing the community spread with someone who's potentially infected, right?
Right. Absolutely.
And you actually have an interesting type of test. I wanted to tell us about what exactly makes it different from what's out there.
Sure. So the major difference that we have is we've implemented a collection kit that we put together in-house. And the reagent that's in the testing vial, it actually inactivates or kills the virus. So it's a safer way to transport these tests. In addition, it doesn't need to be refrigerated. So right now, most all of the collection kits that are out there need to be on ice or refrigerated for transport. So with this, our couriers can pick those up and ship them. We typically use Aloha Air Cargo, again, keeping things local. So those will then go on and be tested the next day. So it's a safer and easier way to transport, and it's the same test once it's in the lab. So these are all done by, FDA approved. They're all emergency use authorization protocols that use PCR testing. So it's a, well-known way to test to look for different viruses. This is how influenza, different tests can be done. So that piece is the same. It's just our collection kit is unique.
Okay, well, that's good to know because there have been a lot of questions from our viewers about what's the difference between kits. There's been some criticism or reports of faulty kits. Can you kind of clear that up?
Sure. Well, and I think that obviously there's always so much information right now. It's hard to decipher what's true and what isn't true. From all the studies that I have been looking at and all the research out there, the nasopharyngeal swab is still the most effective way to obtain the virus. So your most likely chance of catching a positive is through that mechanism. So all of our swabs are nasopharyngeal swabs. And of course, like any test, it needs to be done properly. I know you had it done on you with Dr. Miskovich. So
that
it's not
very comfortable, but it was just to have the experience and know what everyone else is going through. I mean, that's what you have to do.
No, it's and so it's not a comfortable test, but really that's the best way to do it. And then at that point, really it's pretty straightforward as long as all the proper steps have been taken.
Okay, well, that'll rest our fears, at least, or concerns. Now, I wanted to talk about the business side of it because you are a business. The lab operates this, and a lot of people have been asking us about how much do these companies actually make from processing the testing? Is this part of the shortage or the demand? Or give us a little insight on how much the tests actually cost you to do and what's passed down to us.
Sure, sure. Well, it's been interesting to say the least. We have worked to bring this in-house in really record-breaking time. And so to do that in Hawaii, since we're in the middle of the Pacific Ocean, we've had to incur added costs to get things to us fast. For example, nothing's coming on a barge. It doesn't matter if it's a 1,000-pound biosafety hood, we're air freighting them in. So that's our choice. That was my choice to be able to do this quickly and get it rolling. So that expense is something we take on. But the test itself just in reagent costs is a very expensive test to run. I still don't have the exact figures all nailed down, but I would say in reagents alone, upwards close to $40 a test. So that's before you have personnel, overhead, all the other expenses that go into this. So there's really not much of a profit margin at what Medicare is currently reimbursing. Medicare actually increased their reimbursement, which was nice to see, because it probably would have been a loss at what they were originally reimbursing. They've now increased it to $100 a test. I was very nice to see that HMSA decided to do more than that, which was very supportive, because there are some plans that are still wanting to just reimburse at $50 a test.
Wow.
So it's, and then you also have your uninsured patients, which there's still a question there really on where is that payment going to come from? Do we as the lab absorb that cost? And my guess will be that there's going to be a large percentage, that we never see payment on. So as far as somebody through cash pay, we're setting our cash pay rate where Medicare is, so $100 a test. I feel like anything above that really is unnecessary. And I'm not doing this to make tons of money. We're doing this to serve the community. So that's where our goals are. But the business side does matter. Somehow everybody has to get paid.
Well, and we do get a lot of questions about it. And, there's been some, I guess, a little bit of controversy with the city of Honolulu trying to do this deal with a mainland company and paying $200 a test with something. Again, that's a sense of someone trying to get tests done quickly and being able to serve the need. It wasn't meant to think about the money part of it. What's the challenge there in terms of coordinating all these pieces? You as a lab, as a doctor, and trying to work with our state and our counties to try to, have a cohesive response to COVID-19.
Right. I think obviously, as always, communication is key. I've been in communication with Department of Health and Dr. Miskovich and Josh Green. And I think continuing that communication, it might be nice to see a group Zoom meeting with a handful of us. I'm sure that's happening. I've not been a part of any of those yet, but I've tried to let them know that we're here to help at a cost that's not exorbitant, and I think that that's important. This is the way I feel one of the ways we're going to make a comeback until we have a vaccine. So this is going to be around for a while, and we need to figure out some systems that work so our economy can get back up and running. I know you've seen these numbers, but in the Wall Street Journal the other day, Hawaii is the #1 highest unemployment in the United States right now.
Nearly 40%.
It's unbelievable.
Crazy. Yeah.
So I think this is one of the ways antibody testing, that getting these results quickly can get things so that they can reopen and start to run again.
Yeah, you mentioned antibody testing, and you're also trying to work into that as well. What's your take on that going forward, using that?
I think it really will be essential. Dr. Alan Wu, who's our lab director, he was fundamental in developing that test. He was actually in USA Today a few weeks back with that. So he's helping us look at bringing that in-house as well. We would be doing it quantitatively, so we would be able to give an actual number of how much antibody is there. There's so much unknown for all of us in medicine right now. How long does immunity last? All these questions that are unanswered. So this is really new territory for all of us.
Well, and I do appreciate it. It's a great story also because you're local. This is a local business. You know, we talk often about how long it's taking to get things to the mainland, but now if we can do everything in-house and have our own sustainable ecosystem for testing, this seems to be the way forward.
Absolutely. I mean, I'm so proud of my team. They just really have pulled together and embraced this. So it's exciting for them to be a part of this and to be a part of something bigger and have a passion behind what we do. So this is just one more thing that will add to all the other services we already provide. But I'm anxious to see where it goes and here to help in any way we can.
Okay, wonderful. Thank you so much for joining us today and telling us about the great work you guys are doing over, and it's the Big Island, no less. That's great. Thank you so much. Dr. Lynn Welch with S&G Labs joining us today.
Thank you so much. Have a great weekend.